Thank you for coming to my TED-esque talk, where I'll be discussing The Ghost Map by Stephen Johnson. Beyond the history of London, discussions of social mores, prevailing methods of thinking, and the bacteriology of cholera, the book details the efforts of our protagonist and deuteragonist, the physician John Snow and the Reverend Henry Whitehead, respectively. The 1854 cholera outbreak on Broad Street in the Soho neighborhood of London would otherwise be considered a blip that can be dismissed due to the sheer scope and scale of cholera worldwide, were it not for the efforts of Snow and Whitehead. 100,000 people had died from cholera in London alone between 1853 and 1854, and tens of thousands more in the countryside. Deaths worldwide were in the millions, ranging from Japan to Cuba and the United States, with the disease traveling by international trade routes and killing more in the Crimean War than direct combat. The Broad Street outbreak, which claimed just over 600 lives, would otherwise be considered a blip, were it not for the observational skills of our main characters and their efforts at data collection. They eventually made a case towards cholera's origins and transmission due to tracking the behavior of those in the neighborhood and finding a common theme amongst those who had fallen ill or died. They had all drunk, during the timeline of the outbreak, from a local water pump whose underground supply had become contaminated due to a leaking cesspool. If we were to apply modern standards of treatment and prevention to the events the book describes, even the response to the local outbreak, to say nothing of the citywide outbreak, would be considered a colossal systemic failure. There was no access to care, no standardized method of treatment, and the assertion at the time was that the disease was spread via miasma, or bad air. Unsafe, inaccessible, ineffective, slow, clannish, and exclusionary, with the onus of disease placed on those who were just smelly and dirty, any reasonable person would call this a systemic failure. But I don't think so. It was not a systemic failure because there was no system available to fail. With nothing fully realized or capable, what official methods or elements in place were unprepared, under-equipped, or simply unwilling to address the problem. Instead, there was a sort of proto-system of dedicated individuals and local knowledge which would arise to challenge established entities and attempt to overcome the prevailing theories of the time. The only instance of it being less than a complete failure was, according to our course's metrics, the fact that disease was so virulent and widespread that it didn't exclusively target one group or neighborhood. In this particular instance, we're focusing on the Broad Street outbreak due to its service as a catalyst for system-level thinking and nascent epidemiology, but cholera outbreaks were occurring every few years and causing tens of thousands of deaths in the city and countryside. The fact that Broad Street outbreak was centered in Soho, which is a profoundly working-class neighborhood, and existed in the shadow of more affluent and less badly hit neighborhoods, really just served to enforce the miasmatic's position. The widespread acceptance of the miasma theory, and the associated ideas that unclean living and personal behavior were to blame for the spread of disease, just remained a profound social force for blaming the victim and asserting that they brought it on themselves. Not equitable, lacking respect, inefficient, and just ineffective. There was no established network of specialists or experts either, but we can see their origins even as they struggled. A public health department that was trained in data sampling and observation, but not yet able to free themselves from confirmation bias and mired in their efforts on surveys and lifestyle and behavior. The Epidemiological Society of London was just 4 years old, as a dedicated group of inquiring minds, but unable to make headway because they lacked means and established methodology to use the data they found. There were municipal water companies that were supplying drinking and washing water to towns and townships and houses across the city, but they were drawing their water from the Thames, where the waste from toilets and streets and tanneries was emptied. In spite of these obstacles, Snow and Whitehead demonstrated their evidence to the point of convincing the Soho Village Council, who removed the handle from the pump and stopped access to the source of disease and contamination. Now, the disease was so virulent that at that point it had pretty much killed everybody it could and run through its supply of human fuel like wildfire, but the act was one of powerful symbolism and directness. The legacy of this outbreak we can see in cities around the world and in multiple academic disciplines, but I feel it's best summarized in two specific areas. The first, which is intensely mundane, is that the ongoing outbreaks and increasing severity necessitated a greater investment in infrastructure and the strengthening of legislation and public policy. When cholera would reemerge with two epidemics over the next 20 years, a citywide sewage system was under construction, and the waterborne disease process had been accepted by the medical establishment. 1871 would be the last mass outbreak of cholera in the City of London, despite the fact that it would continue worldwide for the next 100 years and more. Major cities in the UK and worldwide would follow their example. John Snow's efforts had taken root in the second point, which is that his tracking of different supplies of water and the results of those who drank it throughout the city served as a double-blind study. The famous map of deaths during the outbreak is an iconic image describing disease clustering and data modeling. This rigorous approach of information gathering and critical thought has placed John Snow in the pantheon of epidemiologists, and I feel his efforts are also emblematic of the same human nature we saw rise to confront the problem. In the absence of an official system, we'll see something fill the gap. Society, just like nature, abhors a vacuum, and even without centralized direction, and sometimes in spite of cultural momentum and accepted knowledge, curiosity and attention to detail are powerful forces for good. And I'd like to conclude with two thoughts. The first one is from the miasmaists. The theory of miasma is that it pays to remember that conventional wisdom and what is known can always be challenged. Having the full force of common understanding and social momentum behind your conclusion doesn't guarantee success or truth, and can in fact lead you to cul-de-sacs of assumptions and self-perpetuating bias. From the burgeoning epidemiologists, we can't forget the lesson that it's not at times enough to just be right. Having the correct conclusion must also be accompanied within the understanding of how you got there, what separates the answer from the details surrounding it, and that you must subject your information to intense scrutiny. Lastly, from the collaboration of Dr. Snow and Henry Whitehead, we see that local knowledge and technical expertise are well served by combining their efforts. It wasn't just the poring over of tables and compilation of data that brought the campaign to a successful conclusion. It was the fact that Snow had spent days walking up and down the streets, spending reams of paper and ink compiling his tabulations and information, and his reputation as a forward-thinking adopter of scientific techniques and cutting-edge medical developments. It was also the fact that Henry Whitehead was a native of the neighborhood, that he'd spent years meeting people, gaining their trust, he knew who to ask and where to go, and he was able to open doors, literally and figuratively, that Dr. Snow's reputation couldn't. His initial resolve was to challenge the results of the study, but when he joined and saw his evidence, they combined their efforts and moved to investigate and campaign together. Last of all, it was the resolve and dedication by both to literally get their hands dirty, to climb into the cesspools, to enter the homes of the sick and dying, and to even drink the contaminated water themselves. It may not have been glamorous, but it was necessary. So in summary, health systems organization criteria consider it ones across the board, by virtue both of endemic and systemic failings, but also of the fact that there was very little analysis ready to be done, and what we're in fact seeing is the emergence of something entirely new. Thank you.